Dr. Uma's podcast is a series of podcasts providing career advice, work-based tips and learning skills, helping you become a better doctor with a healthy work-life balance. These podcasts are in association with MRCPCH Specialty Courses, who specialise in courses in interview skills, application form writing and communication skills. Check it out on mrcpchspecialitycourses.co.uk. Hi, welcome to the second episode of preparing for your clinical exam. And hopefully you've watched the first part. So this is just going to be a continuation from what I've already talked about, which was when you should start preparing. I've talked about the books and I've talked about courses and how you should approach them. In this part, what I'm going to talk about is how you should approach practicing. And also going to just sort of talk about the stations and just sort of how you should approach them and how you should think about them. Not on an individual basis, just on a general side. Then we'll also talk about certain things that may go wrong in your exam, and just from my own personal experience, what I thought was a good thing to do. So, stations. You're going to have a video station where you're going to be showing loads of clips. That's quite tricky to prepare for because you don't really know what to actually revise, but think about it. What are the things that are going to come up? It's going to be clinical signs. You're going to have a child. I remember someone with celiacs, very classic features. What's the diagnosis? What test would you do? What would be your management, or what single best test? So with that in mind, it's going to be things that you can watch on a video and say, that's the diagnosis. And then from that, the other questions will stem. A lot of your neurological signs are also going to come up, because they can't bring all of those into the exam. So they probably will bring those, particularly the acute emergencies. I remember once there was a sick baby, bronchiolitis, working really hard. What would be your next step? How would you escalate care? So again, it's going to be things where you got to have a very visual sort of approach and say, that's what it is. That's what I'm going to do. And that's how I would approach it. Like all sort of computer-based assessments, don't get flustered, don't know the answer, come back to it. Don't waste time sitting there thinking, because by the time you come to an answer, if it's taking you for a long time, you probably run out of a lot of the time for that station, and then you've missed out on all the questions you could have got right. So you've sacrificed doing one answer for 3 or 4 that you would have got quite quickly. So just pace yourself and be conscientious. This is taking too long. Let me come back to it. Now, the clinical skill stations where you're going to do cardiac and respiratory and gastro, neuro and so forth. Now, we are going to prepare. You're not me. You're going to prepare thinking, okay, there can be any condition within this system that may be, this patient may have a sign. I'll have to find it. I'll have to know what to do with it. But think about that. With every system, there are a group of conditions. It's going to be a common condition. So they're not going to pull out something that's super rare. But it's also got to be stable. So not going to give you a child who's got acute emergency signs like increased cranial pressure. That's not going to be there in your station. That child should be in hospital. So think about stable lesions and things that are not going to get unwell very quickly. Those are the ones that are going to come up in your exams. I mean, you might say, well, that hasn't narrowed it down a lot. But to be honest with you, I think it has. Because there are only so many conditions it can be per system. And then they're going to ask you at the end of the clinical station, what your differential diagnosis. So always have a list of things that it could be. Try to think common things are common. Try to think, things that are you're most likely going to see in real practice. So go back and say to yourself, in my department over this year or last year, as I've been working as a senior SHO, what are the things I commonly see? It's going to be that. They're not going to pull out a super rare condition. And also they're going to ask you, what would you do? What's your, what tests would you order? think basic first. So if you have a child with a murmur, you're not going to jump and say, I'm going to do an echo. You're not going to do an echo. Likewise, if you want to do a bronchoscopy on someone, you're not going to do a bronchoscopy. That's going to go to a tertiary centre, to a specialist, and that has to be arranged. What can you do in the paediatric assessment unit? Observations, bedside tests, an x-ray, yes, peak flow, things along those lines. What can I do at the bedside? What tests can I order locally? And then what are the more specialist tests that this child's going to need? Or what tests are going to differentiate between condition A and condition B? And that's the way you need to approach the answers when the examiner's asking you about what you found. Be very concise in your presentation. You should get used to that. So when you're on ward round, start presenting your cases. When you're in the assessment unit and you have your huddles throughout the day, present your cases to your registrar. Present your cases to your consultants. Get into the habit of just being concise with what you've seen and what your plan's going to be. And that's going to be really good practice. Communication skills. So if you've seen my last video, I'm very big when it comes to communication skills. I think that it's a skill that we either take for granted or we don't, prepare properly. And when I talk about courses, I say to people, did you go to a comm skill course? They go, no. When I ask people, do they generally go to communication skill courses? They say no. So, well, how are you preparing for the clinical exam? Well, I'll do some as part of the course that I'm on, but the courses focus a lot on the practical skills, the examination skills. And I think that you should really dedicate, I know it may only be a couple of stations, but again, these are points, marks that you're going to sacrifice unnecessarily. So do practice your comm skills. And again, your long history stations are going to be chronic conditions, stable conditions, but you're going to need to understand the complications of these problems. So what are the reasons why this child with this chronic condition may end up in hospital, and what are you going to do about it? I mean, there are other things that can come up, so I should just throw that as a disclosure, but these are the ways you should start thinking about what you're seeing. Communication skills, whilst I'm on that, when you're thinking about, well, how do I prepare? One really useful tip I have is go and find patient leaflets online. So all these NHS and UK government websites, official ones, they always have a section for parents and families. Those are fantastic at explaining the condition in a very basic, simple language point of view. And I think you should really invest in some time in looking at how it's been explained, because we are terrible sometimes at explaining very complex things to families because we use a lot of unnecessary medical jargon. And the way I've learned to get away from that is I see the language that's used in these leaflets, and it's a really good way of explaining things and breaking bad news and talking about treatment plan. So what I also want to talk about is, how do you then go about practicing? Some of it's going to be by yourself. You've got to sit there and learn, either whether you're practicing on a family member, or whether you're just practicing with an imaginary patient, but you're going through the motions of what you're going to check for, what you're going to check for, what are you going to do next, what are you going to, how are you approaching the patient. But eventually you are going to have to practice with real patients. Doing it alone in that setting, it's probably not really helpful, because you want to be given feedback. You want to get used to the feeling of somebody watching you. So, put a message out there to the group. Talk to your friends, your colleagues, who else is preparing, and get a group together and do it as a group. I think it's a really good incentive to have that. Sometimes in some places that I've worked, they've organized evening revision sessions and asked a consultant to supervise it, and they're focused on a particular system. I think that's also a really good idea. And it's a good QI project or a leadership project you could do, saying that I've organized some sort of teaching. But that's a side thing. I mean, I don't want to get distracted with those sort of things, but I think that's also something to think about. But also, even if you don't have patience with science, just practice on each other. Get used to the motions of going from checking this, then I'm going to check for this sign, looking at the hands, looking at the arms, looking at the face, now the main system, so forth and so forth. And I think just getting muscle memory and doing these sort of types of examination is really important. So stuff to do by yourself, stuff to do with friends, and stuff to do with patients, but all together you should have sort of constant practicing. Get used to doing it regularly. Don't leave big gaps in between. So how would I then say to you, you are now at the stage where you are going to go to the exam. Make sure you sleep properly. I remember when I said I had a young baby, and my wife said, look, I think you should just sleep in the spare room. Get a good night's sleep, and then you've got a long journey ahead of you. I had to travel quite far to my exam, and I wanted to be well rested. I did contemplate staying the night before, but I thought it wasn't right. My son at the time was really young, and I didn't want to leave my wife by herself at that time, so I just did the travel in the morning. But again, make sure you are well rested. Make sure you eat something before you go. I know you're nervous and the stress gets to you, but make sure you eat something. Get to the exam, do the exam. Now, this is the one thing I want to say to you. If anything goes wrong in your station, patient's crying, patient has a breakdown, a meltdown, tantrum, doesn't want to participate. I know they'll say to you, oh, but it's part of being a pediatrician, trying to engage with your child. That's true if they're just shy or they're just being very quiet. You should engage with stuff around you. But if you have a child who just really is not going, is not interested, and is super upset, you trying to do an examination is not going to work. So at the end of your exam, don't assume that your examiner will give you benefit of the doubt or make a comment. Tell them. So there's always an external examiner who sort of stays behind and says, if there's anything you would like to discuss, you can tell us. And I remember, because I had a child during a it was a musculoskeletal examination, completely, before I even walked, I could hear this child crying. I walked in, child was crying, was not interested, and it was really difficult to do the examination. I said, look, this is just not fair. I didn't make an issue of it. Like I said, you move on to the next station, you don't dwell on what happened before. But at the end of it, I explained that to the examiner, so it's not fair. I wish for you to take that consideration. And they did. And they went and found out from that examiner and that station. They asked if what I was saying is true. And then they made a note of it. Now, I don't know if that came in handy or not. But I know plenty of times when trainees have said to me, I failed. I can't believe it. This went wrong in my exam. That went wrong on the stations itself. The problem is that if you don't highlight it at that time, you now bringing it up and arguing about it, with the college 3 months later, they can't do anything. There's no evidence. There's no documentation. You didn't mention it at that time. They can't, which is fair. They can't do anything about it. So if you are going into your exam and something has gone wrong, please bring it up at that point. Either they're going to consider it or they're not. But if they have considered it, again, that may help you in the long run. So that's just one tip I wanted to sort of say about the day, because I think that I've just had loads of conversations with people that have said things like that to me, and I feel like, if only they had known, they may have not have failed. So I'm just going to bring that across to you in this episode. But, I hope that you found these 2 parts, useful. This is going to be part of a bigger series about learning whilst working. And I hope soon in the next couple of weeks, I'll be talking about how to prepare for the written paper. So if you haven't, and you're watching this and you haven't subscribed, why not? Subscribe, do click. I enjoy making these videos. I have really appreciated the feedback I've got from people that have watched it, so that these are topics that people should know about or don't talk about, and that's really great. And if there are any things that you would like me to talk about, I'm more than happy to make videos. I know there are some conversations that I'm trying to have as a group, but unfortunately people do feel a bit nervous coming on a podcast, whether it's going to affect their training. But if you have things that you don't want to, but you think it would be a good topic for it to be on video or as a podcast episode, do send us a message through the website, MRCPCH Specialty Courses, or on this YouTube channel. Great. Well, good luck with your exam, and I hope to see you soon.